Pfizer giving us a peek at how well its experimental COVID-19 pill works, according to some new research. The drug company says the pill called Paxlovid cuts the risk of hospitalization and death from COVID by 89%. The study focused on 700 unvaccinated people who took the pill within 3 days of noticing the first symptoms. Pfizer says the pill should also be effective against variants because it works by blocking an enzyme involved in viral replication, even as the virus mutates. Pfizer has asked the FDA for an emergency use authorization, but the agency hasn't set a date to discuss the pill. 1 year ago this week, the first COVID-19 vaccine started going into arms. Pfizer's 2-dose vaccine was the first authorized by the FDA for emergency use. There was a sense of hope and relief as the vaccines rolled out. We hoped it was the beginning of the end of the pandemic. I remember anchoring those newscasts and watching those trucks pull out of some of those plants in western Michigan. Well, of the pandemic, 200 million Americans are now fully vaccinated with those 2 doses. Many are onto their boosters. Today, Paula Tutman checking in with the Beaumont Hospital system. And Paula, it seems those hopes are unfortunately being dashed.
Yeah, you know what, Karen, I remember that day too, and it was really exciting, especially for healthcare workers. So I'm on the Troy campus of Beaumont Hospital, and I've been talking to these frontline workers, and they were so excited because they said they could see an end in sight, but that is quickly dimming. Time travel is not something in a capsule when you're working the front lines, because in terms of COVID-19, today is yesterday. December 15th, 2020, Beaumont Hospital administered its first shot of hope. The vaccine had arrived, and it was electrifying.
I've been reflecting on this because about a year ago is when I got vaccinated, and there was like so much hope and like about what the vaccine was going to bring and how we were going to get through this. I mean, I even shed a few tears when I got vaccinated. And now it's just frustration.
We're tired. Like we want to be done. We know that the vaccine keeps you out of the hospital for the most part. We know it's not perfect. No vaccine is perfect. And we were prepared for there to be, a second or a third booster because a lot of vaccines require multiple doses.
Almost exactly a year later, and even with the vaccine, nurses and physicians are canceling surgeries, seeing untold suffering, and living through the early days because those early days haven't gone away. When not enough people get vaccinated, it affects everyone, even those who do.
It does not take a medical degree to walk down our floors and see who's been vaccinated and who hasn't.
And the patients are getting younger.
These kids don't have to get sick. They really shouldn't be getting sick. They become a vector for passing things on. And there's no risk with COVID in children. There is still risk.
Today, the tools are available so that this doesn't have to be the thing that ruins lives. But a year after that first shot was given, COVID is still the thing that can ruin lives.
I really wish I could understand why people have chosen this one thing to not want to put in their body. There are so many things. If you go to the grocery store and you read the package of some of our favorite foods, they have a whole lot of things that we can't pronounce and probably don't know what they do to us long term. But for whatever reason, people have chosen to draw a line here, and I think it's a mistake.
This is so incredibly frustrating for so many first-line workers. And Karen, I want you to go back to what that doctor said when she said that it's like mass casualty training. That's how they treat this, and it's chronic. They're doing it every single day. Stay with us because at 5 o'clock, we also go back to the nurse. She talks about the one case that changed her as a person and as a nurse, and it's heartbreaking. Karen?
I was going to say, it really is, Paula. Early on this pandemic, obviously there were a lot of cameras and attention to some of those frontline workers, and they still are working so horribly hard, and it is gruesome, some of the hours and the time and the things they have to see, and sometimes I think people forget that.
Yeah, and keep in mind, we're like a year after the vaccine, and they're working just as hard as they were when we didn't know anything.
Right, we thought it was going to be different. All right, thank you, Paula.